representatives from PAHO, WHO, UNICEF, IDRF, Ministry of Health, Ministry of Education, Office of the President, colleagues, dedicated stakeholders, community partners, and esteemed guests. It is my honor to welcome you this morning to the launch of the National Mental Health Initiatives. I'm Dr. Sarah Hack, and it is my pleasure to be chairing you through this morning's program. Today marks a significant step forward in the government's ongoing commitment to improving mental health outcomes and providing accessible care to everyone. Today's launch is especially timely as the month of May is recognized globally as Mental Health Awareness Month. This observance underscores the urgency of our efforts and highlights the importance of our theme, Mental Health for All, Accessibility, Awareness, and Education. This launch is not merely a formal occasion. It is a reaffirmation of our collective responsibility to address mental health challenges with sensitivity, inclusivity, and urgency. These initiatives not only prioritize accessibility and support, but also aim to break down the barriers of stigma and isolation that too often surround mental health challenges. Mental health intersects with social, economic, and community well-being, impacting individuals from all walks of life. As such, our initiatives are designed to be comprehensive, addressing not just treatment, but also prevention, education, and long-term support. Throughout the program, we will witness the unveiling of tools and resources designed to support mental health across communities. These include an insightful animated series that aims to raise awareness, a website dedicated to providing information, along with 24/7 chat support, and the introduction of the toll-free 915 Suicide Prevention Hotline, a crucial lifeline for those in crisis. To further underscore the significance of the animated series initiative, I would now like to invite Ms. Guyana Fordyce of SBM Offshore to further elaborate on this. After which, we will have a special presentation. For the first time, we will be showing you an episode from this animated series, which was designed to raise awareness and understanding of mental health issues. Please join me in welcoming her.
Minister of Health, Honorable Dr. Frank Anthony, representatives from the Office of the President, Dr. Jessica Anthony, Dr. Sarah Hack, distinguished guests, stakeholders, ladies and gentlemen, good morning. My name is Guyana Fordyce, and I am the Sustainability Lead at SBM Offshore Guyana. It is both a pleasure and an honor to stand before you today for the official launch and screening of your Mental Health Matters project. This initiative is incredibly close to our hearts at SBM Offshore Guyana. We are proud to have partnered with the Office of the President to bring this project to life. A vision rooted in collaboration, care, and deep commitment to our youth. This project stems from a commitment made from our former CEO, Bruno Shabazz, one that was reinforced and recommitted by our current CEO, Oyvind Tangen. It is partnerships like these between government, the private sector, and communities that truly make a lasting impact. When we come together with a shared goal, the result is more powerful than anything we could achieve alone. There's a popular saying that children are the future. And while that is true, we at SBM Offshore believe that our children are also the present. They are living in today's world, facing today's pressures, and they deserve our attention and support right now. The video series you will see today reflects that commitment. It tackles real mental health challenges, anxiety, depression, cyberbullying, in a way that is accessible, relatable, and empowering for young people. These stories are designed not just to inform, but to spark conversation, build empathy, and inspire action. They are meant to educate, yes, but more importantly, to encourage children to speak up, to reach out for help, and to understand that they are never alone. While SBM Offshore Guyana is well known for our work in the energy sector, building and maintaining world-class floating production, storage, and offloading vessels, we also hold a deep commitment to well-being of people in the communities where we operate. So today, we invite everyone, whether you're in this room, or in school, or at home across Guyana, to watch these videos, share them, use them as a starting point. Let's begin conversations that matter. Let's help build a culture where mental health is understood, supported, and prioritized, not just for our children, but for all of us. Thank you.
Hello everyone, welcome to your Mental Health Matters, a series aimed at discussing mental health issues faced by youth in Guyana. This is a production of the Office of the President, supported by SBM Offshore Guyana. In this episode, we address anxiety.
Tanisha, why are you so quiet lately? You look all in your feelings, man. This is not like you. Is something bothering you?
I don't want to talk about it.
We's your friends, and we don't like seeing you so quiet. Is what bothering you?
Okay, but please, don't make fun of me for saying this. I failed the English test and I can't get over it. It's the first time I have done so badly on a test, especially English. I was so anxious that I hid the test from my parents.
Don't tell me it's a little test that got you in your feelings. I failed that test too. But look at me. I am the least bothered.
Omar, is what happened to you? Everybody deals with things differently, and this is how Tanisha is dealing with it. She's taking it on.
This is the first test I have failed. I don't know what is going on with me because I usually ace all my exams. I feel like such a failure. I feel very sad and overwhelmed. And I'm so nervous thinking about any other exam. It's like I can't even sleep since this happened. My parents will be disappointed when they find out about this. They were very angry with me before over a smaller assignment. I just feel so worthless.
Sorry, buddy. I forget how you just take on them things.
You know, Tanisha, the way you are feeling, it sounds as though your mental health is taking a hit.
Mental health?
Mental health is all about how people think, feel, and behave. It can affect daily living, relationships, and physical health.
Yes, Tanisha, your mental health affects how you view things and can lead you to being sad for some time, even though you may not understand why.
You know, it's okay to not be okay. You can get over this feeling. It will pass. Don't let it be the boss of you. I'm sure you can do much better in the next test. Maybe you could talk to your cousin in Form 5. She might tell you how she handles these feelings of anxiety.
If you don't want to speak to your cousin, you could speak with Miss Veronica. She's the school's counselor. I have spoken to her already, and she is very understanding.
You spoke with the school's counselor before?
Yes, I have. I go through hiccups too. Miss Veronica listened to me without yelling at me, something my parents would usually do.
Thank you guys. I feel a bit better now. I will talk to Miss Veronica about how I feel.
You know, Tanisha, when you are feeling this way, you can do something to take your mind off of it. You can take a walk outdoors, read a book, or write in your journal. Just do something different.
Thank you, Debbie. I'll give it a try. Your mental health is important. It affects your overall well-being and daily interactions. Just as we take care of our physical health, our mental health should be a priority too. It's okay not to feel okay. You are not alone. Speak to someone you trust about how you feel, like an older sibling, a cousin, or an adult like a teacher. Other resources you can use are the Ministry of Education's School Support Services Unit, the Ministry of Health's Mental Health Unit, and telephone number 225-0804 or 223-6604.
Thank you for those remarks, Gwinnetta. I hope you all found that episode as impactful as I did. Raising awareness through creative storytelling can truly make a difference. In addition to the screening of this first episode, in our second session this afternoon, we will be inviting 50 school students from around the country to witness the screening for the first time of episodes 1 to 4 of the series. Next up, I would like to invite my colleague, Ms. Jessica Anthony from the Office of the President, to tell us all about the mental health website and chat support. After which, we will present a short demonstration video to give you a better understanding of how the website works and how it can support mental well-being. Please join me in welcoming Jessica to the podium.
Good morning, everyone. I am excited, honored, and truly privileged to stand before a distinguished audience such as yourself during Mental Health Awareness Month, and to be able to tell you about an initiative that my team and I have been working on for quite some time now, Guyana's mental health website. mentalhealth.gov.gy started as a brainchild of our president, His Excellency Dr. Mohammed Irfan Ali, who strongly believes that improving mental health is essential to improving the lives of all Guyanese. It's a commitment from the highest level of leadership and one that we are proud to carry forward. This is also evident in the leadership of the Ministry of Health, from our Honorable Minister all the way to the teams across the country who work assiduously towards improving health and well-being. Today, we're not just launching a website, a hotline, or an animated series. We are launching a vision. We're launching a vision of a Guyana where mental health is no longer whispered about behind closed doors or met with fear, shame, discrimination, silence. A Guyana where everyone, regardless of age, gender, race, background, or circumstance, has information, support, and resources to be kind to their mind. Speaking of kind to your mind, it's not just a catchphrase. You'll see it on the posters. You may have received 2 QR codes that look like this on your way in. I would like to encourage you to use your devices, scan them, and take a look at where they lead you. One will take you directly to the website, and the other will take you to the Kind to Your Mind Facebook page, where we regularly share accessible, curated content on mental health. So it's more than a slogan, it's actually a growing community. That was just a little side note, by the way, so let's get back to talking about the website. The website gives us a centralized, accessible, and trusted space where people can learn more about mental health and access various resources. But the part that I am most excited about is the 24/7 chat platform that we have built into this site. Some people prefer to talk about their problems, while some people, for whatever reason, may feel more comfortable to type. The chat platform is equipped with trained mental health support agents. Yes, they are real people, not chatbots or AI, who are there to listen and support. Whether someone is dealing with stress at work, family conflict, struggling with substance use, having exam anxiety, and these are just a few examples, our agents are there to listen and to help. The chat service is confidential, and no one is required to provide any personal contact information unless they willingly consent to or request follow-up services, which, by the way, are provided for free at the mental health unit. In case of a mental health crisis or emergency, the chat client will be directed to the 915 hotline, which Dr. Morgan will tell you more about. This entire operation could not have been possible without the support and commitment of many partners who collaborated with us both from the Office of the President and the Ministry of Health's end to make this happen. And I'd like to quickly just say thank you to the teams at the Mental Health Unit, to NDMA, to our partners at Consulto, Hoosty Designs, and WeSolve CX for their patience, flexibility, and dedication in helping to bring this vision to life. I'd like to wrap up by saying that while I believe this website will be a meaningful and impactful addition to Guyana's mental health service landscape, a website alone will not transform mental health in Guyana. Transformation truly comes through each and every one of us, through the conversations that we start, the compassion we extend, the courage we build, and the resolve that we show to destigmatize mental health as a collective, as a country. Let us remember mental health is health, and together we can build a more kind, caring, resilient, and mentally healthy Guyana. Thank you, everybody, and we'll now premiere a short video demonstration on the website, and later on you'll have a chance to interact with it more in the lobby downstairs, and it's on your QR codes as well.
If you're dealing with stress or anxiety, you don't have to face it in silence. The Ministry of Health and the Office of the President have launched a mental health hub to provide round-the-clock support and resources. Access helpful information, speak with trained support agents, and get referred to licensed professionals who care. When you don't know where to turn, start here. Visit us at mentalhealth.gov.gy.
Thank you, Jessica, for shedding light on this crucial online resource. That was an insightful demonstration showcasing how technology can bridge the gap in mental health support. The leadership shown by the Office of the President and the Ministry of Health, as well as our other dedicated partners in spearheading this initiative, has been remarkable. The commitment to prioritizing mental health on a national agenda demonstrates a visionary approach to healthcare, one that is rooted in empathy, resilience, and a deep understanding of the challenges our people face. Next, I would like to invite Dr. Timothy Morgan, Director of the Ministry of Health's Mental Health Unit, to tell us about the 915 toll-free suicide prevention hotline. Please join me in welcoming Dr. Morgan to the podium.
Good morning, everyone. I'm pleased to be here and give you this little bit of overview on our new 915 emergency suicide crisis hotline. The history of this hotline is in answer to the needs of the persons in Guyana to make mental health services more accessible wherever they are. Originally, in 2022, the Suicide Prevention Act was passed, of which decriminalized the act of suicide. Another part of that act called for the establishment of emergency suicide helplines. Later on, in 2024, the National Mental Health Action Plan and Suicide Prevention Plan was launched. In this plan, there was called for the establishment of a suicide crisis helpline. In fulfillment of these commitments or these policies and legislations that were there, today marks the launch of the Ministries of Health 915 emergency toll-free 24/7 National Suicide Helpline. And I am pleased to announce that the journey has been very fruitful, and with the support of the leadership of the Ministry of Health and with other partners such as PAHO WHO, Global Affairs Canada, and the NGO IDRF. I would like to thank everyone of our partners, and more especially the leadership at the Ministry of Health and our collaborating partners such as Office of the President, to making us together working as part of a national mental health platform.
Minister of Health, the Honorable Dr. Frank Anthony, whose support and guidance has been instrumental in executing these initiatives as we continue to prioritize mental health as a national agenda. Please join me in welcoming the Honorable Dr. Frank Anthony.
Good morning, members of the diplomatic community, Dr. Kim Dickinson, the PWR for PAHO WHO, the staff of the Office of the President, and all the stakeholders who are here this morning. I'm very pleased to be here, and normally you say you're very pleased to be at a function. But this morning, I'm especially pleased to be here because over the last couple of hours, I have seen the ministry being transformed, and it's now a different space. Even this room that we are so accustomed to being in and have so many functions, this morning was really special. I really want to congratulate the team from the Office of the President and the President himself for taking this initiative. Mental health is one of the challenges that we have in our country and has been one of the areas that have often been neglected. We don't pay too much attention to mental health until it starts affecting us. And many years ago, Guyana has been known to have lots of cases of suicide and lots of challenges with mental health. But because of dedicated efforts, we have started to turn that around. I also want to congratulate the Mental Health Department of the Ministry of Health, headed by Dr. Morgan. And you can see that over the last couple of years, that indeed we are changing the outlook for mental health. When we look at mental health and perhaps suicide prevention as a subset of the issues relating to mental health, it is a big problem globally. And in fact, statistics from the WHO would show that every year, close to 800,000 persons would die from suicide around the world. To put that in perspective, basically it's the whole population of Guyana dying every year of suicide. And that's something that we should think about. And persons die because of a number of problems. One is that they're not diagnosed early, so they might have a problem and they have nowhere to go. They don't have any access to service. Sometimes they have a challenge, but they don't have a means of getting to someone who can help them. And this has been a big problem. Mental health issues, such as the one that we saw in the video, anxiety, can lead to challenges, and then you can have attempted suicide. So I think when we look at mental health issues that can actually cause attempted suicide or suicide, things like anxiety, depression, these are matters that we have to educate our population about. There are other factors that can contribute to attempted suicide, things like loneliness. And sometimes with all these devices that people use today, we have somehow neglected the face-to-face contact, the association with people, and we are on our devices. This can also lead to a lot of loneliness, which can be a factor, a risk factor for attempted suicide. Low self-esteem can be another problem. Societal stigma can be a problem. There are conditions, health conditions or other conditions, and because of the way our society treats people, it can also lead to people feeling isolated. Sometimes persons with physical disability can have challenges. Sometimes the way that we treat persons with physical disability can lead to them having depression. And these are things that, as a society, a caring society, we have to be a little bit more mindful. Feelings of hopelessness. It's not always we have this, but during our life course, from time to time, we might feel hopeless about some problem or another, the challenges that we're going through life. This can be something that we have to pay attention to. And then, there are some people who might have various challenges. They're living with family, and they feel like they're a burden to their family. And that too can be a problem, because it's how they perceive how others are treating them. And so there are many, many things outside of the medical realm that can lead to people considering committing suicide. So taking all of this into consideration, this is not a Ministry of Health problem. This is a societal problem. And if we are going to deal with it, then all of us would have to work together to make sure that we can reduce the amount of cases of persons attempting suicide, or for that matter, we would like to see no one in this country actually committing suicide. Over the last couple of years, because of the President's commitment to mental health, you would have seen Guyana making some rapid steps in changing the outlook for mental health. So one of the big changes that we have made is to look at our legislation. Our laws were dated to 1934, and that's a long time. And up to about 2-3 years ago, this was the law of the land. And when you read the law, some of the terms that were being used, in today's society, we would not use them, right? So we were happy to be able to change the law, and we now have a new Mental Health Act. We also, while we were doing this, we recognized that we want to have a direct focus on suicide prevention, and so we also did a separate law that is called the Suicide Prevention Act. But having done those two things, we wanted to make sure that we can implement what we're saying in the laws. And so one of the things that we did in collaboration with PAHO WHO is to develop a new mental health action plan. And this has been very important because we have clear objectives of what we want to do in the action plan. We also established a Suicide Prevention Commission, which is a multi-stakeholder commission, and they have been working to ensure that they can educate the public about suicide prevention. We also, the government, has been giving the commission a subvention so that they can do their work. And hopefully with other private sector partners and so they can work with these various initiatives so that we can expand them. We also, at the level of the ministry, working with some of our partners, we have also undertaken other initiatives. And one such initiative that we took on was gatekeepers training, because we recognize if we have persons in the community that are trained, then they would be the first place where they can intervene and help people. And I think over the last year, in collaboration with funding from Canada and IDRF, we have been able to reach out to close to 900 gatekeepers around the country and train them. And so we are getting feedback from them, and then the unit at the Ministry of Health would be able to respond more appropriately. We also recognize that when people come into our primary healthcare system, that one of the challenges that we have is that our doctors very often do not talk to people about mental health. So we talk to them about all the other things, but sometimes we ignore mental health. So we want that to be in focus, and we have given them training in the MHGAP training, that is the WHO certified program. We have trained more than 100 physicians across the country to be able to do this. Because one of the things that often we don't diagnose because we don't ask, we don't do anything about it, has been depression. And we know that there's a correlation between people being depressed and wanting to attempt suicide. We have also done, in collaboration with PAHO, being able to train the media, because the way that the media report issues relating to mental health is of vital importance. And we thought that it was very important for us to also work with the media so that they can have a better understanding of mental health issues. And so while we have been doing this, and of course, another thing that we have been able to do in the ministry, we had a lot of our services for psychiatry being concentrated at the Georgetown Hospital or at the Fort Kanji Hospital. And these have been the two main sites. But over the last couple of years, what we've been trying to do is to send our psychiatrists out. And so now we have services in Regions 3 and Regions 2. We have extended services in Regions 4. We have in 5 and 6 and 10. And periodically, we are able to send teams out to Regions 1, 7, 8, and 9. So that we are now trying to do a countrywide coverage so that people needing specialized psychiatric services would be able to access that. We also have 81 sites now where we have telemedicine. And we have been using these telemedicine sites not just to deliver teleconsultation, but we have also been able to do telepsychiatry. And that became quite useful when we had the tragic incident in Madhya and the surrounding villages. We were able to use telepsychiatry to counsel a number of persons who were living in these communities and being affected. So this network, this expansion that we have been able to twin technology and use it so that we can reach out and give people better mental health services is one of the goals of the ministry, and we have been constantly trying to expand that. And this brings me now to this special initiative that we have, because I think in the assessments that the Office of the President, the team at the Office of the President would have done, they realized that while maybe we have approached mental health issues from a very clinical point of view, that's one good thing to have. But it is also about reaching the audience, and that is also very important. And there are gaps in how we have been getting out that information to people. So I'm extremely pleased that with the work that they have been able to do with the partners, that these videos that have been developed, they're very simple, but they're very impactful. The one that you just saw. You're able to identify the problem, you can model behavior, and you can teach someone what to do if they have a problem. And all of that is captured in that very, very short video. So this series, I think, is going to be very, very useful for the children in school. And I'm sure it would have an impact on all the children in school. We have in the ministry a school health program where we are targeting school children. We are doing screening for them to see whether they have a physical health problem. But I think with tools like this, videos like this, we'll also be able to assess, to see, or identify issues along the mental health lines. So I think this is very important. And I want to commend the Office of the President team, along with their partners, and all the persons who were involved in the development of these videos, because I am very, very confident that it would have an impact on our school children. But more importantly, an adult looking at this can also learn something, so they can see when a child is not behaving appropriately, and maybe use the knowledge that they've gained from films like this to help and to intervene. And instead of the parents screaming at the kid, as was reflected in the video, you have to have a totally different approach. The website, obviously, it's a fantastic tool because we'll be having lots of up-to-date information. And if we want to make each one of you an advocate for mental health, then obviously you want to have a place where you can get those resources. And that website is going to serve as that repository where you can get lots of resources and use it, not just for your personal growth and personal understanding, but encourage organizations who can use it so that we can spread the word around. If we get more people embracing this, learning about it, and helping to change the behavior of persons in our society, making us more compassionate, more understanding, reaching out to someone when they're not feeling too well, and so forth, I think we'll change how we view issues around mental health. And the website is certainly going to be able to do that. And of course, we know from time to time people might have acute challenges. You want someone to talk to. The hotline is going to help to do that. So call us, make sure that you could talk to us. And what Dr. Morgan did not say is that if you call the hotline and they recognize that somebody is in crisis, then they have a rapid response team that would actually go out and get to that person and work with them. So it is, over the last couple of years, we've tried to expand what we are doing. Of course, there are still some gaps. It's not perfect, but I'm sure with all your help, we would be able to even improve it. And I'm sure the team, both at the Office of the President and in the Ministry of Health, we look back to your feedback. But more importantly, we want all of you to partner with us so that we can ensure that the people of our country would have a good mental health. It shouldn't be a problem. Suicide should not be a problem anymore because we are all going to be concerned about this and be able to act to prevent these things from happening. So once again, let me thank the staff of the Office of the President for being able to do such a wonderful job, the team here at the ministry, but more importantly, I want to thank His Excellency, our President, for putting so much effort, so much leadership and guidance in ensuring that mental health is on the national agenda. Thank you all.
Thank you for those kind remarks, Minister. It is of utmost importance for us to realize that and remember that mental health is not just a medical issue, but a social responsibility. We must continue to create safe spaces for dialogue, break down barriers to care, and champion policies and plans that protect and uplift those living with mental health conditions. We have now come to the end of our program, and I would like to re-invite to the podium my colleague Jessica, who will be delivering the vote of thanks along with myself. In closing, we want to express our sincere gratitude to everyone who has contributed to the success of these initiatives. Everyone in this room has played a part in that. Your dedication and passion are the driving force behind our efforts, and we are confident that together we can build a healthier, more compassionate society where we can all be kind to our mind.
And I'm really going to ask you guys to applaud as I go through all of the people that we'd like to thank, because trust me, they all deserve the applause and appreciation. So like I mentioned before, the commitment comes from the very highest level of leadership. And I'd like to thank His Excellency, Dr. Mohammed Irfan Ali, for his vision and commitment to improving the health and well-being of all Guyanese.
The execution of this broader vision and everything you see here today would not be possible without the dedication of the leadership of the Ministry of Health, the Minister, the Permanent Secretary, and everyone who has worked with us to make this a reality. Special thanks to Dr. Morgan, Dr. Constantine, and the entire team from the Mental Health Unit who have been there with us every step of the way. Special thanks to the Ministry of Health's PR team, specifically Shabana, Alicia, and Aubrey.
We'd also like to extend a special thank you to our team at the Office of the President, Mrs. Marcia Nadir Sharma, for her leadership and guidance, P.S. Abina Moore, and the entire Special Projects team who have been with us the entire way. Their support has been invaluable, and we are grateful to have such wonderful people in our corner.
We'd also like to thank our partners, NDMA, Hoosty Designs, Consulto, and WeSolve, who all played integral parts in the development of the website.
Thank you to the teams at SBM Offshore and Sagacity, whose creative minds brought to life the animated series that you were able to be the first to publicly view here today.
On behalf of Dr. Morgan, we'd like to extend sincere gratitude to PAHO and IDRF, as well as the Ministry of Human Services and Social Security for their technical advice, support, and guidance during the setup of the 915 hotline.
Last but not least, thanks to you for taking the time out of your schedules and recognizing the importance of being here today. Thank you for your unwavering commitment to mental health and mental health advocacy.
The conversation does not stop here and shouldn't only happen during Mental Health Awareness Month. Let us move forward with hope and determination, knowing that our efforts will create a more compassionate and supportive tomorrow.
Once again, thank you everybody. Join us for refreshments outside. Take lots of pictures, grab some merch. If anybody wants posters or QR codes to take back to their offices, we have those available over there in that corner and also downstairs. So please take back material, share them as widely as you can. And don't forget to tag us at Kind to Your Mind on social media when you take pictures of the event. Thank you.